everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have started discussing about the process of urination, or we can also term it as the urinary elimination, here in this session, we are going to discuss about the acts of urination. Here, as we have known that urination or urinary elimination is the process of removing the excessive fluid or the metabolic waste from the body. So how can one urinate? How does this act of urination takes place? Here what will be happening is that there will be presence of several brain structures which will be influencing the bladder function, and these brain structures include the cerebral cortex, the hypothalamus, the thalamus, as well as the brain stem. So here these four brain structures will work together, and they will also inhibit the urge to void or will even allow voiding. Because here the normal voiding occurs only when there is a contraction of the bladder as well as a coordinated relaxation of the urethral sphincter as well as the pelvic floor muscle. So here what I mean to say is that in order for this act of urination to take place, there are several brain structures which has a direct influence on the bladder function, and these brain structures include the cerebral cortex, the hypothalamus, the thalamus, as well as the brain stem. So here what these will be doing is that they will be working together in order to inhibit the urge to void or in order to also allow voiding to take place. And here, as we also know that normal voiding can only occur when there is contraction of the bladder as well as a coordinated relaxation of the urethral sphincters and the pelvic floor muscles. So here for this urination to take place, so in order to lead to a normal process of this act of urination, it is very important that these brain structure as well as there must be a good coordination between the contraction of the bladder as well as the relaxation of the sphincter muscles and the pelvic floor muscles. So in order for this act of urination to normally take place, it is very important that there must be a good coordination between the contraction of the bladder as well as the relaxation of the urethral sphincters and the pelvic floor muscle. And here it is very important for us to remember that the bladder capacity will differ from one person to the other, but it would generally range from 600 to 1000 milliliter, and also an adult will normally void for every 4 hours. However, an individual will also be able to sense the desire to urinate even when their bladder will just contain a small amount of urine, which can range from 150 to 200 milliliter, and when it is for a child, then it can also range from 50 to 100 milliliter. So here when a person feels the desire to urinate or when he starts getting the urge to urinate, he can urinate it, or even sometimes you may find that, we try to hold it in, right? However, this can only be done until the bladder is not full. Once the bladder is full, once the bladder is fully expanded, then you will not be able to control it and you will be having a strong desire or a strong urge to urinate. So here it is very important to teach the parents especially that the children do not have enough neurological development to be toilet trained until after the 24 months. But this will vary from one child to other, because for some it may be after 24 months, whereas for some it may also be after 36 months. So this is the reason we cannot expect to toilet train the kids who are below 24 months or even 34 months, because here no matter how much you try, they will not be able to understand since they will not be having an enough neurological development. So as I've said that an individual will start getting the desire to urinate as soon as the bladder contains a small amount of urine. However, if he does not urinate it at that point, then as the volume increases, the bladder wall will also stretch, and this would send sensory impulses to the micturition center, which will be located in the sacral spinal cord. So here it becomes a responsibility of these impulses which is sent from the micturition center to either respond or avoid this urge, thus making urination under the voluntary control. So here, if a person does not choose to void, then the external urinary sphincters will remain contracted, and this would also inhibit the micturition reflex. However, when a person is ready to void, then what will happen is the external urinary sphincters will relax, and then these micturition reflexes will stimulate the deextrusor muscle to contract, and this is how an efficient emptying of the bladder will occur. So here it becomes very important for the nurse to understand this process in order to be able to assess and also to determine the form of incontinence, or even if there is any problem in the bladder which is occurring. Because here, if there is any damage to the spinal cord above the sacral region, then it can also cause reflex incontinence. And because of this condition, it can also cause loss of voluntary control of urination. But here what happens is that even if this occurs, however, this micturition reflex pathway will remain intact. And if this occurs, it will ultimately allow urination to occur even without having the desire or the urge to urinate. And also here, if a person is suffering from any chronic obstruction which is caused by neurological damage, such as the prostate enlargement, then this can also hinder the bladder emptying. The micturition reflex will also change, causing bladder overactivity, and which can also possibly cause the bladder not to be fully emptied. So here, if a person is suffering from any chronic diseases, or if a person is going through any chronic obstruction, or even if there is any damage to the spinal cord above the sacral region, then it can also cause reflex incontinence. And also here, an overflow incontinence can also occur when the bladder is full, and also when the bladder pressure exceeds the sphincter pressure, which can ultimately lead to an involuntary leakage of urine. And this overflow incontinence of urine usually happens when there is any head injury, spinal injury, multiple sclerosis, diabetes, trauma to the urinary system if the person is under post-anesthetic, sedative, hypnotics, tricyclics, as well as analgesia. So here, when a patient is having an overflow incontinence, then this can also be caused because of these conditions. And if a person is also having hyperreflexia, which is also a life-threatening problem, then here this can also affect the heart rate as well as the blood pressure, which is mainly caused because of an overflowy full bladder. So here, this hyperreflexia is usually neurologic in nature. However, it can be caused functionally by blockage as well. So this is how urination takes place. This is how sometimes, because of the presence of various conditions, it can also lead to a reflex incontinence as well as to an overflow incontinence. So here, this pattern of urinary elimination largely depends on the psychological, on the social, as well as on the emotional factor, on the degree of the neuromuscular development, as well as on the integrity of the spinal cord, on the volume of the fluid intake, as well as on the fluid loss from the body, the amount and type of food consumed, the person's circadian rhythm, as well as on the habits that a person is following, on their opportunity to urinate, as well as if a person is suffering from any depression or anxiety. So here, this pattern of urinary elimination will differ from one person to the other, and this largely depend upon these factors. These largely depend upon the psychological, on the emotional, as well as the social factor, as well as it depends on the fluid intake and the fluid loss from the body, the degree of neuromuscular development, the opportunity to urinate, the urinating habits of a person, the type of food which they consume, as well as on their circadian rhythm. So these are the various patterns on which the urinary elimination of a person largely depend on. Now let us discuss about the general measures that we can advise the patient to take in order to promote urination. So here, these measures include providing privacy, assuming a natural position for urinating, that is a sitting position for women and a standing position for men. by maintaining an adequate fluid intake as well as by using stimuli such as running water from a tap in order to initiate voiding. So these are the various measures that we can advise the patient to adopt, or we can assist the patient with in order to promote urination. So now here we have come to the end of this small topic, whereby in today's session we have discussed about the act of urination, where we have come to know how urination take place and what are the various diseases that can also affect the normal urination pattern of a person and also can affect the amount of urination. And then we have also discussed about the pattern of urinary elimination as well as about the general measures that one can take in order to initiate urination. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session. Until then, have a good day. Thank you.